wrist right now. Okay, a 5. So since your wrist is not in excruciating pain, I'm gonna go ahead and start by doing an examination on your head to see why you may have passed out, okay? So just go ahead and sit right there, and I'll try to wrap this up quick so we can get you pain meds for your wrist, okay? Alright, so first, I'm going to use this, and I'm just going to check your heartbeat. So, would you just sit up straight for me, and let me see. Okay, and can I have you take a deep breath? Inhale and exhale, okay? Okay, so your heartbeat is just a little fast, but it might just be the adrenaline from the whole situation. So, next, I am going to use my thermometer here and take your temperature. So, I'm going to put my gloves on for this. And now that I got my gloves on, I'm going to just put this up to your forehead and roll it across, okay? It'll just take a second. Okay. And your temperature is perfectly normal, so that is a good sign. Next, I am going to check your blood pressure. So, I'm just going to wrap this cuff around your arm, okay? And I'm going to squeeze it, and you might feel a little pressure, and it might be a little uncomfortable, but just bear with me through it. It'll only be a second, okay? So I'm just going to counting down the beats. Okay. Alright, your blood pressure is also perfectly normal. So far everything is normal. That's a good sign. I'm going to check your reflexes now though. So just sit up straight. I'm gonna hit this on your elbows, and I'm gonna check your fingers and your knees, okay? So just sit still and I will. Very good. I'm just gonna check it a few times. That was good. Let me check this side. Okay. There we go. I'm gonna check your knees real quick, so just sit your knees out, okay? Good. Good. I'm gonna check your other knee. Good. Good. So now I'm gonna check the reflex on your fingers. I'm really just concerned about the hand that you fell on, but I'm gonna check both hands, okay? So give me this hand that's not injured, okay? Good. 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 And good. Now can I have you flip your hand over? Thank you. And I'll check just a few points on the inside of your palm. There we go. Now I'm gonna check your injured hand, and I do apologize in advance. This might hurt a bit, but I'm not gonna hit close to your wrist because I don't want to hurt your wrist, okay? So let's see. Does that hurt? A little. You can feel it in your wrist, okay? Just go ahead and flip your hand over. I'm gonna check one point on the inside of your palm, okay? There we go. So your hand reflexes are fine, but on the injured hand, I can tell it's a bit painful, and the reaction is a bit jerky. So that's not good. Next, I'm going to just check in your eyes, and I'm checking for any symptoms of a concussion since you did fall and you blacked out. Are you having any headaches since you passed out? No? Okay, good. So I'm just going to look in your eyes with this, and I'm going to use a flashlight, so it's about to be a bright light, so just go ahead and prepare for that, okay? Just going to look in your eyes and then use this tool. Look in your eyes. Like this. Over here. Okay, this eye. Your pupils are reacting exactly as I would expect, so that's a good sign. And I'm going to do some tests without the scope. lastly, how many carrots? These are carrots. How many do you see? 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6. So very good, very good. You did great counting the fruit and vegetables. So the last thing I want to test is your blood sugar levels. And I have this machine here. I'm going to just prick a little bit of your blood, okay? And I'm going to test it to see how your blood sugar levels are. So this thing down here, this end down here, will emit a little tiny needle. You shouldn't feel it at all, and it will test your blood. So can I say this hand right here? And if you want, you can close your eyes or look away if you're a little nervous. So just sit still. I'm going to take a sample. Okay. was nothing too serious. But if you have any other symptoms or it gets worse, do not hesitate to call back and